back with episode number 3. Welcome to the Right Byte. So, for those of you coming for the first time, you should know that we mostly talk about jaws, sleep, and everything that's related around it. So, in the last episode, we talked about something called as airway orthodontics. So, we were thinking as to what needs to be spoken next. So, we came across a very new topic, probably very new to a lot of us, something called as tongue ties. So, we have our guest speaker today who shares his expertise in tongue ties. So all the way from Delhi, we have our expert speaker, Dr. Abhimanyu Chaturvedi with us. Welcome, doctor.
Hi, Karthik. Thank you for having me.
So how's Delhi at this time of the year and how does it feel to be in Bangalore?
Delhi is really hot, man. 52, 50. And Bangalore right now is really pleasant.
So how does that shift feel like? You came all the way from Delhi the moment you landed at Bangalore.
Yeah.
You should have felt something.
Yes. Relief.
Relief.
But I'm used to it. It doesn't bother me, the heat.
Mm-hmm. So, doctor, since you've been practicing for a few years now in Delhi,
Yeah.
so I want to understand how has Delhi evolved with respect to dentistry? How was it when you started practicing and how is it now?
So, no doubt there is a lot of competition. I did my undergraduation from Lucknow.
Mm-hmm.
I am from Lucknow basically. And then I shifted to Delhi around 12-13 years ago. And after doing my post-graduation again from Ghaziabad, I started my clinic in Delhi. I lived there. And but competition is always good. The awareness regarding oral health as compared to 10-12 years ago has risen and for the good.
What was that point wherein you realized that tongue ties is something that you should be dealing with? Because obviously I'm assuming that you did not start off your career with tongue ties.
Yeah.
So you must have started off with something.
Yeah.
But then you might have arrived at this point.
Yes.
So what was that point wherein you realized that, I should be helping with tongue ties?
So my specialty is in endodontics. I started as doing root canals. And the funny thing was, or how I got introduced to this field of neuromuscular dentistry was, as an endodontist, we regularly do root canals and then we put a crown on top of a root canal treated tooth. I noticed something that my patients were complaining of. Initially, they felt that the bite was right after placing the crown. After a few days or a few weeks, they used to come to me stating that they feel something, that the jaw has shifted or the bite is wrong. Many patients, so as an endodontist, we usually prefer in most cases to do a single sitting root canal treatment. In just one sitting, we just finish even the teeth which are called molars, which are placed back or way back in the mouth. So the patient has to open their mouth consistently for a long period of time, 45 minutes to an hour. I noticed that many patients were complaining of headaches, the jaw muscle pain, the masseter muscle pain. They're complaining of clicks in the jaw joint. Many patients had a temporary locked jaw. This also I experienced when I was doing my post-graduation. We had a lot of patient flow. So this is how I slowly started thinking out of the box that there is something more to the teeth. We should look at the joint of the jaw and the surrounding muscles also. And that is how I came and got introduced to the futuristic field of neuromuscular dentistry. And it dramatically changed my way of thinking and my patient experience. And
But
for example, I would say, because many dentists can relate to this, upon placing a crown, many dentists, they encounter very frequently that the crown is coming out or they just pop out within a few weeks or few months, even few years. It's not supposed to come out because the cement that we use is really strong. Why is it popping out is because of sleep bruxism or clenching. This is a very common observation of any dentist who's placing crowns. So neuromuscular dentistry includes sleep dentistry also, and this is how we used to tackle sleep related issues. And so we are practicing neuromuscular dentistry for more than 10 years. I personally am practicing for more than 10 years. And this is how I got introduced to the field of neuromuscular dentistry. This is how I met Dr. Raj. And we collaborated together in Delhi. And that is how the journey started.
But how do you see the awareness in patients today?
Unfortunately, in my opinion, the awareness is not, it's low.
Mm-hmm.
It's not common knowledge. So how I got into the tongue tie aspect is in our clinics at the Right Byte, we often encounter patients who are suffering chronically with facial pain or TMJ pain, and many of them have a component called as a tongue tie. In the scientific field, we call it as ankyloglossia. And then I dived more in detail in this topic. So I found out that if somebody has an improper tongue position as a child, or the tongue is functionally tied, there is an increased chance of underdeveloped jaws, breathing problems, and that is how eventually the cycle starts. And when the child grows and becomes an adult, unfortunately they suffer from this chronic pain.
But when we say tongue ties, I think many of us might be puzzled as to how it actually looks like. So I want to understand as to how tongue ties can be, how do they look like?
So traditionally in dental school, we were taught about anatomic tongue ties for ease of interpretation and understanding. Suppose if somebody is not able to touch their roof or the upper jaw with their tongue, they have a really severe anatomic tongue tie. That is common knowledge amongst dentists also. But what at the Right Byte we do is we do functional tongue ties. We try to diagnose if functionally there is something wrong with the tongue. We follow the Dr. Zagi's protocol. I have done my training under him. Dr. Zagi is very clinically renowned and ENT surgeon in the United States of America. So I was fortunate enough to do my training under him. So we follow the functional aspect of the tongue tie. Unfortunately for patients or the general mass, they won't be able to diagnose themselves functionally. So they have to just approach us or visit any of our offices and meet me so that I can tell them whether there is a problem or not.
But is there any way I can diagnose it myself, saying that I might have a tongue tie, so I need to visit a doctor? Is there a way to do that, or how do I arrive at a doctor saying that, doctor, I have a tongue tie?
See, I would simplify this. If somebody has no symptoms, there are nothing such as a pain or TMJ pain. If the guy is asymptomatic, don't worry about it.
Mm-hmm. But is tongue tie in itself a problem, or is it a cause for many other problems?
Both. So it is a leading cause which leads to aligned teeth, narrow jaws, and eventually high chances of developing some sort of facial pain or TMJ pain. But if the importance of tongue tie is during childhood. If a child has a problem, if he is not able to put his tongue at the right spot in the jaw, which is called proper tongue posture, or if he is mouth breathing, high chances are that that child has a tongue tie. That tongue tie is a piece of skin, for ease of understanding, which is, if it is attached in front of the tongue too forwardly, it prevents the tongue from resting in the upper jaw, which is the proper tongue posture. Now, when your tongue is in your lower jaw, you are not able to breathe through your nose, you will breathe through your mouth. And which then starts a whole entire cycle of problems. So mouth breathing is not good. Even ADHD is also related to mouth breathing. If nasal breathing is not happening, our sinuses produce a gas called as nitric oxide that should be mixed with our air which we are inhaling, and then it goes inside the body. That is how it's supposed to be. It's also very good for immunity. So I can go on and on, but ideally the intervention should be at the level of childhood.
So, doctor, what's the ideal time for someone to get checked for a tongue tie?
See, ideally it should be checked and intervened at childbirth, right? But if not, if for some reason that is missed, we have ample of time. The child is growing almost till ages of 13, 14, but preferably 7, 8 years, I would say. It should be checked.
But how do you handle tongue ties for someone like a small 4-year-old? Like, what's the process involved to fix these tongue ties?
See, as far as a 4-year-old is concerned, if we have diagnosed that there is some issues with the tongue, this is the best stage to start with something called as myofunctional therapy, or in short, tongue exercises. So we don't go in for a release at the right bite for small children. We teach them certain types of exercises that they have to do every day. We teach the parents also so that they can keep a follow-up on the child, ensure they are doing it. What that does is, when the child is doing the tongue exercises, the tongue is a very strong muscle actually, and it forces the jaws to grow in a proper and a directed method and way. So in children, depending upon case to case, I would first start with a lot of tongue exercises. Then eventually we see that whether a release is required or not.
But then I've also read a lot of stuff on Google, so you can debate me on that. But I came across a lot of articles wherein it says that you need to get some kind of a surgery done for tongue ties. So what is that situation?
I would not say it's a surgery, it's just a small release. I use a laser, it's bloodless, 5-10 minutes tops. In, get it done, out.
So the science behind tongue ties, it seems very relatively new to me, because 20 years back, was there something like a tongue tie, or was there a doctor who used to treat a tongue tie?
So this is a very interesting question. Actually, it is mentioned thousands of years ago in our yoga and Ayurveda about Khechri Mudra. So Khechri Mudra was related to tongue ties. In my superficial knowledge of Khechri Mudra, the candidate who was diagnosed with a tongue tie under a guru, he used to get a tongue tie release. So it's very interesting. It's not anything new. It's, in my opinion, ancient knowledge, which we forgot, but now the awareness is slowly coming up.
Do you also know how they used to do the release back then?
What I have read somewhere was there was a particular species of a grass which had a really sharp blade on it, and that was used probably, but don't quote me on that. I might be wrong.
But as for tongue ties, I don't think a small kid would be able to diagnose or probably realize that he has tongue ties. So I think only parents would be able to kind of, be aware of that his or her child might have a tongue tie. So what should be the warning signs for parents to kind of realize or, recognize that a child has a tongue tie?
I would say first and foremost, and the biggest sign would be if the child is mouth breathing. That is the biggest thing that the parents should look out in the children. Not tell them anything, because they might get conscious. Depending upon their age, they might get conscious and start. So habitually, how they are breathing, the parents should just notice the children. That's it. That is the biggest warning sign that I can say. If the child is mouth breathing, that is not good for the child.
But then again, tongue ties in itself, is it a problem that someone must visit you for, or is there a series of problems that tongue tie causes? What are these problems that it causes?
Good question. So, suppose a child is mouth breathing. He or she could have a tongue tie or some sort of blockage in the upper airway, which we call the nose and the upper airway. So, at that point of time, the child might not have any issues, but because the child is growing, and if the tongue is not at the proper position inside the mouth, there are high chances of the jaws not growing to the full potential, teeth being malaligned, and tonsils being inflamed. And if these things happen, then the child will have to breathe through the mouth, because now he or she is not able to breathe through the nose. So, and then the growth will be hampered. There is a chance that the child might have concentration issues because he or she is not able to breathe through the nose. And then once the child grows up, unfortunately, because we have a lot of patients who come to us at that stage after growth, they have TMJ pain or some form of facial pain and sleep issues. So it is always better to intervene while the child is growing, I would say.
So do you get a lot of patients who are at a very young age to your clinic right now?
Now we have started to, because the awareness is slowly growing. We are also trying our best to spread the awareness as much as we can. Our students who pass out from our courses are also doing justice to this field and spreading the awareness. Many parents are aware. Many parents, they tell me that they know that breathing through the mouth, for example, if a child is just drawing a picture or doing some form of activity where there is no physical activity involved, still he or she is mouth breathing. So the parents get concerned, then they approach us. So the awareness is growing, which is a really positive news for us.
So apart from mouth breathing, are there any symptoms that parents can dominantly notice? Probably mouth breathing might go unnoticed in a few parents. So is there anything else apart from mouth breathing that parents can recognize?
So then I would say just notice how the child swallows food. In patients or in children who have some sort of tongue issues or a tongue tie or tongue tonicity issue, they usually, when they swallow, the tongue sort of comes in between the teeth, which it's not supposed to. So the parents can notice that also, the way the child swallows. And the third thing that I would also suggest is notice how the child sleeps while sleeping, whether the child is nasal breathing or breathing through the nose or mouth breathing. If the child is mouth breathing, we should do something about that. It's not healthy for the child.
So if the child is mouth breathing, is that also an indication of sleep apnea?
There is a possibility for that, because when the tongue is resting low, usually what happens is the tongue also falls a little back and it occupies the area of the airway. So it is hard to say. There is something called as a sleep study that can be done to check for sleep apnea or some sort of sleep disorder breathing or any issues related to sleep.
So would it be fair to say that tongue ties are one of the symptoms of sleep apnea?
Tongue tie, there are many literature that tongue tie is associated with sleep, some sort of sleep problem. So normally when the tongue is tied, it is not able to rest in a proper position where it should be. It falls low and behind in the mouth and occupies the area of the airway, and it might contribute to sleep apnea or some sort of sleep disorder.
So tell us a bit more about what untreated tongue ties could lead to.
So as a child, mouth breathing could lead to severe reduction in concentration, inflammation of the tonsils, because the child is mouth breathing, so the mouth tends to dry up. So there could be many cavities happening because the tongue is not resting in a proper position. So the jaws, development of the jaws might not reach their full potential. Underdeveloped or narrow jaws, long face, there's something called as long face syndrome. So the face should grow forward and broad, the jaw should be broad. Instead the face, it grows more like longer. So long face syndrome can happen, and eventually when the child grows and the growth stages are done, adolescents and adults, then high chances of sleep, some sort of sleep problems, sleep bruxism, sleep apnea, and eventually that might unfortunately convert or manifest as some sort of pain in the head and neck, and then the patient does not know what to do, and this cycle, untreated, turns into a chronic episode. It turns into a chronic event. So chronic pain, so the guy or the girl is suffering since years of some sort of neck pain or jaw pain or a headache that could have been easily dealt with.
So then my next question is that whether tongue ties are developed only during the course of your childhood, or can it be developed much later during your adulthood?
Actually, what we see in adults as a tongue tie is their tongue tie being missed or not being diagnosed at either birth or when they were growing as a child. And even if we intervene at that stage, we can get rid of it, but with just some exercises of the tongue in most cases. But once the growth is finished, then you need some form of intervention. You need a release.
So I want to understand what's the process behind releasing a tongue tie. So are they very painful, or what's the process that is involved, or is there anything special that you do that not most of us are doing?
Not at all painful. It's just an OPD procedure. Under local anesthesia, we use laser. It's completely bloodless. Within 5, maximum 10 minutes, it's done. And then I just give you a standard prescription of painkillers. That's it.
So you were saying about having a functional approach to treating tongue ties. So I want to understand all the tongue tie, like people who treat tongue ties out there, are they following the same process as you are?
No, so the Dr. Zagi's protocol that we follow is functional tongue tie release. In the functional aspect, we not only check the anterior part of the tongue, which is called anterior tongue tie, we also check posterior tongue tie. So whether the patient is able to raise the posterior part of their tongue also in a proper way. So that is the main distinction.
Suppose I miss out on the tongue tie in my childhood and I have grown out to be a complete adult now. So now I come to you saying, doctor, I might have a tongue tie, or you might tell me that I have a tongue tie. So what are the benefits that I am going to see after my tongue tie is released?
Good question, Karthik. So what at the Right Byte, we on a daily basis have people with chronic facial pain or TMJ pain. But in such patients, if there is a tongue tie, what I've noticed is, I'll give you an example of a patient which has nothing to do with our dentistry field. That patient had TMJ pain. I diagnosed it having a functional tongue tie. We did a release, and the patient reported after 2 days that his lower back pain is also gone, which was very surprising to me. He did not tell us that he had also a chronic lower back pain. He was suffering since years. But then it made sense to me, because the tongue tie that we are talking about is something called as fascia. So fascia is essentially a very elastic piece of skin or a cloth, as an analogy, which holds everything together. So fascia holds your organs, your skeleton. It's like a soft skeleton. It holds everything in its place. So and anatomists have classified fascia. I know it's going to be a little technical, but just bear with me. It has been classified into its planes, the way it is attached. So the tongue tie is a part of fascia, which is called as the deep front plane, right? That goes from your tongue till the back of the head all the way to your toe. It is one single piece of skin, so to say. And a tongue tie is actually a myofascial restriction. It's restricting somewhere. It's causing some form of strain. So the moment I released that strain in the form of a tongue tie, that patient after 2 days told me that his lower back is also feeling much better. So we have had, eye-opening patient testimonials. Chronic lower back pain, also improvement in that. So it's really, really fascinating.
So for the cases that you deal with, when a patient comes to you with tongue ties, do you directly suggest them to go for a tongue tie release, or is there anything else that they can do before they go for the release?
No, what my protocol is, I firstly give them a very specific set of tongue exercises. for a specific amount of time. I keep a follow up on my patients. Why I do this is the tongue for years is habitual to sitting in an improper position inside the mouth. If I go straight away for the release, there are high chances of a relapse or a reattachment, which I don't want. So I train the patient, give them a specific set of tongue exercises, keep a follow up. Once they clear that stage, once I am satisfied that they are doing those type of exercises, then I go in for a release. And after the release, I might add or subtract a couple of exercises. Now, the reason I give them exercises is to break the old muscle memory, to retrain the tongue, something called as neuroplasticity. So the more you do the proper exercises, the brain is also trained, and eventually the tongue will just go and rest in the proper position that we want. And then when you go in for a release, which hardly takes 10 minutes max, the results are amazing.
So, do you have any instances of such tongue tie exercises that have worked for patients?
So in children, because the growth is happening, changes are happening, I usually don't go in for, again, case to case might be different. I don't go in straight away for a release. I would like to give them certain set of exercises for a slightly longer period of time and keep a follow up, because the tongue is doing its exercises, the child is able to keep the tongue in the proper position. Chances are that the tongue tie might resolve or the severity of the tongue tie might reduce. Then we can take a call on the release. Interestingly, I had a patient, she was from Russia, and we were treating her for her TMJ pain. And one day in the dental office, her daughter came up to me and we were just talking, and she started doing some sort of tongue exercises which caught my eye. Then I told her to do it in front of me. So she knew certain set of exercises that I usually teach the patients. I asked her who taught her. So she told me that in her school in Russia, it is mandatory for all the children in her age group to do these exercises, which was really fascinating to me.
So I think we're moving on to the last leg of our podcast today, and I would like to ask for your closing statements as to what would be your final message to everyone who's kind of ignoring their tongue ties.
The tongue should be in the proper position. We can have good broad jaw development, nice teeth, healthy development of the child, and we can avoid potentially all chronic pain and sleep related issues in the future. So please don't ignore the tongue.
So that was all that we needed to know about tongue ties today. If you have anything specific that you need to know about tongue ties, drop your comments in the comment section below and Dr. Abhimanyu would be happy to help. In the meanwhile, just head over and like our video and probably subscribe if you like our content. Thank you.